So fats are our last macronutrient, and many times we tend to use the term fats and lipids interchangeably. However, lipid is more of a broader term. So lipids include some other things. They include triglycerides, they include sterols, they include phospholipids. The lipids of greatest significance in nutrition, however, are triglycerides, fatty acids, phospholipids, and cholesterol. Triglycerides are basically formed by the union of what's called glycerol with three fatty acids. So the majority of lipids found in food in the body are in triglyceride form. So many times throughout this, we're going to kind of use, fat is going to be referring to triglycerides. So like carbohydrates, fats contain carbon, oxygen, and hydrogen. However, because fatty acid chains have more carbon and hydrogen relative to oxygen, fats have more calories per gram. So you get 9 calories per gram in fats, whereas in proteins and carbohydrates, you only get 4. When we're looking at our different fatty acids, we're essentially looking at whether we're talking saturated versus unsaturated, and all that refers to if there is or isn't what we call a double bond. So saturated fatty acids have no double bonds, and all the carbon molecules are basically saturated with hydrogen. So that's why they're called saturated fatty acids. And they are used for certain physiological and structural functions. However, the body can make these fatty acids by themselves, so there's no dietary requirement. Unsaturated fatty acids that contain one double bond are known as monounsaturated, and when fatty acids contain 2 or more, they're considered polyunsaturated. So the unsaturated fatty acids are chemically more reactive. When we're looking at the polyunsaturated fats, 2 are considered essential. Those are your omega-6 and your omega-3 fatty acids. And, both of those fatty acids are necessary for, good brain and nervous system function along with healthy cell membranes. Your omega-6 fatty acids are found in a bunch of different foods. Soybean, corn, safflower oil, all contain omega-6 fatty acids, whereas your omega-3 fatty acids you typically find in a lot of your fatty fishes, like for instance salmon is a very good source of omega-3 fatty acids. And the components of the omega-3 fatty acids you're really looking for are the EPA and DHA. Those are very important as far as like a lot of the health concerns related to lack of those in our bodies. Another way that individuals can get appropriate amounts of omega-3s are through, for instance, like flax seeds and walnuts. They contain what's called alpha-linoleic acid, which can be converted into EPA and DHA, so that could be another way as far as doing that. When stored in the human body, fat does serve a lot of different functions. So the energy is going to be typically stored as adipose tissue. Small amounts can be found in skeletal muscle, particularly in aerobically trained athletes, but body fat does a lot of different things. It actually insulates and protects organs, it regulates hormones, and carries and stores fat-soluble vitamins. So your vitamin A, D, E, and K are your fat-soluble vitamins. So the fat in your body, and again, there's a certain amount of body fat that everybody needs to have. You can't just have no body fat because there would be health concerns related to that. So in looking at fat and its relationship with cholesterol, so cholesterol is a fat-like substance, and again, cholesterol has important structural and functional components, particularly when you talk cell membrane structure. And again, cholesterol is used in the production of bile salts, vitamin D. There's various hormones, including the sex hormones, your estrogen, your progesterone, your androgens, as well as cortisol. And although it does have benefits to the body, high levels of cholesterol can lead to atherosclerosis. So it can lead to that hardening of the arteries. And we have different types of cholesterol. And again, high levels of those, particularly your low density lipoproteins and triglycerides, are associated with increased risk of heart disease. However, your high density lipoproteins, your HDLs, are actually protective, and you can actually increase your HDLs with through exercise and weight loss, and you can kind of get optimal levels of your HDLs, which are protective because they actually help to remove the plaques present in the circulation. So high intake of refined carbohydrates, weight gain, alcohol intake, um, and very low fat diets can actually increase your triglycerides, which are basically your blood fats. Um, However, with cholesterol, several factors affect your triglycerides, including sedentary lifestyle, being overweight, smoking. All of those things will contribute to a lot of the health functions associated with this. So you want to make sure that again the levels of high density lipoprotein. So in other words, when you're getting your measurements done, your milligrams per deciliter, you want your HDLs to be ideally over 60 is a good number. Those would be for your higher HDL, which again is beneficial. Less than 40 would be considered too low. When you're talking total cholesterol, you want to be under 200. 200 to 239 is considered borderline. Anything over 240 is considered high. Your LDL cholesterol, optimally, you would like it to be under 100. 130 to 159 is considered borderline high. 160 to 189 is considered high, and over 190 is considered to be very high. So, and now again, that's for your LDL. So that's what you would want to be looking at as far as if you were to go and get your blood work done, where you would want your numbers to be. So as far as fat goes, it's recommended that 10% or less of the calories consumed come from saturated fats. So that would be about 1/3 of your total fat intake. That's typically where you're going to land. Again, this is just a general recommendation when you're talking about your saturated fats. Ideally, in your diet, you would like most of your fats to actually come from polyunsaturated fats. In particular, it's typically recommended that you avoid any type of hydrogenated oils that contain trans fats because of potential health concerns associated with them. So when we look at fats and performance, the human body has a sufficient amount of fat to fuel long training sessions or competitions. So we look at this for performance. Intramuscular and circulating fatty acids are a potential energy source. At rest and during low intensity exercise, typically a high percentage of energy can come from fatty acid oxidation. However, when intensity increases, of your exercise, there does tend to be a shift from using fats to carbohydrates, just because carbohydrates can be broken down faster. One thing we have noted is that with consistent aerobic training, there tends to be an increase of the muscle's capacity to use fatty acids as fuel. So your body can become more efficient at using fats as an energy source. However, as I said, typically with higher intensity exercise, carbohydrates do tend to be the preferred source in general. If an individual does start to use a low carbohydrate diet, again, the body can adapt to that, but there could be some time to adapt. So it is something to keep in mind, is that if someone were to switch to a low carbohydrate diet, that it could take a period of time for them to adapt. However, again, so that you just want to kind of be mindful of that based upon the type of activity that the individual does, and when you're talking contests and everything, it may not be the time to necessarily switch up when giving dietary advice. It might not be a good idea during certain times that are a little more sensitive to have people making big changes in their diet. Again, the type of diet to which the body is adapted to could influence performance. Again, the high fat, low carbohydrate diets, their effect can kind of vary depending upon the individual. So now we get into our micronutrients. So we talk about vitamins. Vitamins are organic substances that cannot be synthesized in the body, and they're needed in small amounts, and they all perform certain functions. We have different vitamins. We have both water-soluble and fat-soluble vitamins. So we had mentioned the fat-soluble vitamins before, A, D, E, and K. Your water-soluble vitamins would be your vitamin C and vitamin B. So with the exception of vitamin B12, which can be stored in the liver, your water-soluble vitamins aren't stored in the body. And basically what happens with your water-soluble vitamins, the body kind of uses what they need, and then they actually excrete the rest of them in your urine. As far as vitamin B12, I did talk about how they can be stored in the liver. Although there's no known side effects from excessive vitamin B12, consuming more than the body needs won't necessarily, increase your energy or improve health. As we said, vitamins A, D, E, and K are fat soluble and can be therefore carried by the fat in the blood and stored in fat in the body. When you're talking excessive amounts, again, there could be obviously with the fat soluble vitamins, those could put you more at risk for possible side effects just because of the amount that can be stored in the body. Minerals are our other micronutrient. Again, they're required for a wide variety of metabolic functions. And, for athletes, for instance, minerals are important for bone health, oxygen carrying capacity, and fluid and electrolyte balance. So we're going to pay special attention to certain minerals here, and we're going to look at iron. So iron is a constituent of hemoglobin and myoglobin and plays an important role in oxygen transport and utilization of energy. Iron deficiency is actually probably the most prevalent nutrition deficiency in the world. And here you see individuals that are increased risk for iron deficiency. So women of childbearing age, teenage girls, pregnant women, infants and toddlers are all at risk for deficiencies with iron. And again, because of iron's importance as far as oxygen transport throughout the body, so again, iron's important for that synthesis of hemoglobin. You can see what would possibly come of that. So again, your iron deficiency, again, iron's going to help carry oxygen to your working muscles. So when you're talking athletes, even a small amount of iron deficiency could actually impair athletic performance. Iron deficiency anemia tends to develop when low iron stores kind of persist for a long period of time, and the body then can't make healthy red blood cells that could help deliver oxygen throughout the body. And typically individuals with iron deficiency anemia, they complain of weakness, fatigue, irritability, poor concentration, headaches, hair loss and dry mouth. So you started to get individuals with those symptoms, that would be a situation where you would want to possibly test somebody to make sure that they're not starting to get iron deficiency anemia. Calcium is another important one. So athletes who consume low calcium diets can be at risk for osteopenia and osteoporosis. So again, here we're just looking at two different levels of decrease in bone tissue. So calcium is going to be essential for attaining peak bone mass, and any calcium deficiencies can impair the attainment of peak bone mineral densities and increase fracture later on in life. Calcium also helps keep your teeth strong, helps in regulating muscle contraction, plays a role in nerve functioning, blood vessel expansion and contraction, and then hormone and enzyme secretion. So beyond even just bone health, calcium plays a really important part in many different functions in the body. So looking at fluid and electrolytes, so water obviously is the largest component of the body. So anywhere from 45 to 75% of a person's body weight is made of water. And again, water is going to act as a lubricant, a shock absorber. It helps as a building material and as a solvent. It's also essential for body temperature regulation. So again, when an individual's out and their body temperature rises, the water loss through sweat actually helps to cool off the skin and then bring down the body temperature. Water also helps in nutrient transport, waste removal, maintaining fluid balance, and which will help maintain normal blood pressure. So water plays an important part, and adequate hydration is going to be really important as far as, again, being able to maintain all those normal body processes. So particularly when we're talking individuals who are physically active, competitive athletes, maintaining a hydration level is going to be extremely important. The adequate intake for water, for men and women respectively, about 3.7 liters for men, 2.7 liters for women. So that's about 125, a little over 125 ounces for a male, a little over 91 ounces for a female. For pregnant and lactating women, they actually increase that slightly. They look to go 3 liters and 3.8 liters for lactating women. And technically, all sources of fluid constitute water. Now, it is recommended that, by most people, that the majority of your fluid intake should be water. However, coffee, tea, juice, soda can all be combined into this. Obviously, knowing your drinks with calories, and particularly if those calories are obviously coming from sugar, that could create a lot of other health problems associated with that. So that's why it's recommended that typically most of your hydration comes from water. Obviously, from the standpoint of dealing with physically active people and competitive athletes, one of the things we want to be looking at is preventing dehydration because of the health consequences associated with that. So in preventing dehydration, so athletes should try to prevent water losses greater than 2% of body weight. So losing as little as 2% of your body weight, you're actually going to start to see potential impacts on performance, particularly when you're talking exercising or performing activity out in hot weather. And each pound lost during practice represents 16 ounces of fluid. So ideally what you're looking to do is, after a practice or after a competition, you want to make sure that you replace the water that was essentially lost, because particularly when you're having, multiple practices or multiple bouts of physical activity, if you continue to lose more and more weight through water, it's just possibly predisposing you particularly to things like various heat illnesses. So you want to make sure that that's getting monitored. And again, the simplest way to do that is just to weigh individuals before and after activity. And typically the weight loss, in that immediate of a time frame is all going to be coming from water, which then how much you have to essentially replace with the fluid intake that would take place after your activity. So in talking about electrolytes, most of the electrolytes lost in sweat are sodium chloride and to a lesser extent potassium. The significance there is sodium influences fluid regulation by helping to retain more of the fluid consumed, so it helps your body kind of hold on to that fluid a little bit more. And all of the electrolytes lost through sweat are essential to muscle contraction and nerve conduction. So if there's a disturbance in your balance of electrolytes and body fluids, it could possibly interfere with performance. And again, the sodium losses through sweat vary tremendously between individuals. So that's also another thing to note. So in the case, and given the large quantity of sodium that some athletes can lose, replacing those sodium losses may require a conscious decision to choose some higher sodium foods, or have individuals just add a little bit of salt to their foods and possibly add electrolytes to their sports drinks. Athletes who exercise intensely for hours and hydrate excessively with only water or a low sodium beverage may actually dilute their blood sodium to dangerously low levels, and that could develop into something what's called hyponatremia. So hyponatremia could be very dangerous, and it could lead to intracellular swelling. And when the blood sodium levels become really diluted and fall below 125 millimoles per liter, that's when an individual could start to develop headaches, nausea, vomiting, cramps, swollen hands and feet, restlessness, disorientation. So the individuals will start to develop those. So if an individual does start to develop hyponatremia, that individual would have to be referred to a hospital right away to prevent the health ramifications associated with that. And again, to avoid hyponatremia, fluid intake shouldn't really exceed sweat losses. So in other words, again, you could determine how much fluid you need to take in based upon how much weight you lost with your activity. Remember, for every pound, that equals about 16 ounces of fluid. And again, you could also include, again, some, a sports drink, or again, just adding a little bit of sodium to your food that you're consuming can help avoid that as well. As far as potassium is concerned, sports drinks sometimes provide us. We did talk briefly about potassium. Sports drinks sometimes provide a small amount of potassium to replace potassium losses. However, they're not a significant contributor to potassium intake. Again, some of your more potassium-rich foods can kind of help to supplement that. Things like tomatoes, citrus fruits, potatoes, bananas, milk, all has enough potassium to kind of replace the losses of potassium. So again, a key point, athletes who exercise intensely, again, you want to make sure that you're, in those cases, don't just consume large amounts of plain water. Make sure that you're getting adequate amounts of sodium. So just some general recommendations for fluid intake. Again, make sure you prehydrate, so several hours before exercise. Allow for, fluid absorption and urine output. So it's recommended that individuals kind of prehydrate prior to. And again, you could usually tell your hydration status again by, there's various ways you can test it. One of the simplest ways for athletes is to just, have them, they could look at the color of their urine. Obviously, a very dark urine indicates that they're not hydrated enough. Whereas a lighter color would indicate adequate levels of hydration. So it's recommended that before individuals train or exercise, that for several hours prior to, they just allow for an adequate hydration and for adequate urine output. And again, to help dehydration during exercise, so during exercise, for children, about 5 ounces of cold water or a flavored salted beverage every 20 minutes. Adolescents, about 9 ounces, and then for adults, they could kind of follow a more individualized hydration program. So during prolonged hot activity, consume a sports drink, 20 to 30 milliequivalents of sodium per liter to 2 to 5 milliequivalents of potassium per liter, and about 5 to 10% carbohydrates. So, and again, for adults, again, they could follow a little bit more of an individualized plan with that, just making sure that they get adequate amounts of their electrolytes in addition to the hydration. And then we want to look at the post-workout or post-training hydration. So, if you're someone who's really dehydrated, or in particular, we mentioned that it's about 16 ounces per pound that you essentially lost. However, if someone is extremely dehydrated, or if they have a training session that's coming up soon, so they typically say, they have less than 12 hours before the next exercise bout. So, if you think of some sports where they have multiple practices within a day in the summer and preseason practices, they actually recommend a slightly more aggressive approach. So in that situation, they say that athletes should consume 1.5 liters per kilogram. So about 24 ounces for each pound of body weight loss is what they should be looking to do. So this is if you're talking a little bit more severe dehydration, or a case where you're going to have another, extreme bout of activity within a short period of time. So 1.5 liters is about 50 ounces of fluid for each kilogram of body weight, if you're talking the more severe dehydration, or there's another training session that's going to be up and coming.